Hey guys, it's Dr. Yazdan, and we have a patient today where we are doing a repair of her hairline. Unfortunately, she had a hair transplant done out of the country 2 or 3 years ago, and it really didn't look so good. She showed me her pictures of her post-op, and just by looking at the photos, I could tell that the outcome would not be good. But she got her results, and unfortunately, what they did was her hairline design is very straight, and there's really big pluggy grafts in her entire hairline, and that's caused a problem for her being able to wear her hair back, because it really amplifies the hair transplant that was done. So we're gonna fix this for her, and I'm gonna make this as darn good as I can and try to make it look like this never happened. The plan is that we're going to do a strip method, get some hair to be able to reconstruct, use one hair grafts to be able to hide a lot of these plug grafts. And I'm also gonna remove some of these plug grafts with FUE method, and we'll break up this straightness of the hairline, and then soften it up with proper 1 and 2 hair grafts, and just make this look more subtle, soft, a lot more natural, and a lot better. We'll show you guys through the day how we're gonna do this. Not everything, but I'll show you guys a lot of it, and then obviously the outcome. But my goal is to try to reverse this for her and make this look a lot better than when she walked into the office this morning. And I've been thinking about how to do this for about 2 weeks. We do a lot of cases like this, and we're really good at them, but they're all different. Every one of these is different because there's different criteria, and there's different things that have gone wrong. This one, the hard part is how straight they made the hairline, how big of grafts they used, and trying to unwind that there's some challenges, but stay tuned and we'll show you guys how things go through the day. So today's case is really the bad part of the hair transplant industry. A lot of people are just so unsuspecting. They don't really know what's gonna happen. They're like, hey, I'm gonna go overseas, save some money, get a hair transplant, my hair is gonna look a lot better. And that works for some people, but it also doesn't work for others, and the risk is so high. And how much bad work we see is it's really sad. And this patient today, she was very unsuspecting, had the procedure done, had no idea how it was gonna turn out, thought it was gonna be great, and then the hair started growing in, and she realized that something was really wrong. So I'm really happy to be able to do this for her. I'm really happy to be able to fix this. But what people need to understand is I don't have a magic eraser to be able to just take away what happened. We can't go back in time and make it as if nothing happened. I'm gonna improve this, I'm gonna make it a lot better, but there's a limit to what I can do. And these kinds of cases, you really have to think outside the box. They're really not, one is not like the other. And for her, getting rid of this straightness is gonna be tough, and getting rid of those big plug grafts without leaving scarring in her hairline is also gonna be tough. I mean, when I do the FUE through here, there is inherently gonna be a little bit of scarring, but I'm gonna try to minimize that and hopefully cover it with hair anyways. But she already has scar tissue through her hairline because of the way the procedure was done. So I'm just working with a lot of there's just strikes against me to try to make this better. So for patients watching this, we're doing this video for you guys to understand the negatives of a hair transplant, and to really do your research before you go under the knife and have something done. Because once you lay down on that table, you have no idea what's gonna happen to you, and you need to be 100% confident that the practice that's doing your surgery knows what they're doing, and they're good at what they're doing. And you can go back and speak with the doctor. It's like when you go overseas, she has no recourse. She can't go back and say anything. I mean, patients that come to our practice, I have a vested interest to make sure that everything is done right, and that the patient is super happy at the end of the procedure. I mean, it's my reputation and my name on the line, and I take that really seriously. When people go to these hair mills, they don't really care. You're just another number. In the queue, you're just another person sitting in a chair, and that's kind of that. Whereas when you come to a practice like mine, I mean, we make sure everything is perfect for the patient, and that's the way that it should be. So you guys follow along, and we'll show you guys through the day how things go, and I'm really hoping I can turn this around for her. So what we're doing today is for most women who do hair transplants, we do an FUT or a strip method. And what that entails is actually just excising a piece of the scalp tissue and using the grafts out of that. She had an FUE done before. The problem with FUE for women is you have to shave such a large area. You're gonna be shaving about this much of the back of their scalp, which was done on her. And it takes, more than a year for the hair to grow back, and the hair is very thin and empty underneath. So, you can do FUE for women, but generally I prefer to do strip. You are left with a small scar, but that scar is very minimal, and it's never really shown unless if you're going to shave your head, and most women are not going to shave their head. But with doing that, you're avoiding having a year worth of not having hair and having a lot of thinning. The patient also has a lot of scarring back here. After that FUE surgery that she had done, they used a really large punch. That poses some issues as well. The density is a little bit less, but it's fine for this. This is more of a corrective surgery. We'll get enough grafts from that, and then when I take the grafts out of the hairline, we'll also repurpose those grafts and use them during the surgery. So that's kind of the plan for today. We'll do a strip and partly an FUE in order to get the grafts to fix her hairline. So we're done with the strip. I've done the closure. Came out perfect. It looks really nice. Let's have you zoom in. You can see how it's just a very fine line. What you're seeing mainly here is the sutures, the stitches. Once this heals, it's going to be a very, very thin line with hair growing into it. She'll never really see this or, really ever be visible unless if, she cuts her hair very short, which she'll never do. This is a much better procedure, I think, than doing an FUE. Had we have done an FUE, we would have had to shave a very large area back here. This allows her to essentially have all her hair. She'll recover just fine. And so now we're gonna get her sitting up, and we're gonna go to the next part, which is removing the plug grafts out of her hairline and reconstructing her hairline. Our next step in the process is I'm gonna be removing some of the grafts out of her hairline, and we're gonna be doing that using an FUE method. Now that part I'm not going to show how I do it because it's kind of proprietary to what I do, but once the grafts are out, I'll show you guys how they're out, and then how we're going to repurpose those grafts to reuse them. We're not going to throw them away unless if the graft isn't good. Like there's a couple of wiry hairs, like there's one right here. Those ones I'm just going to take out and we won't reuse them. Those were grafts that were damaged in her previous transplant, and we don't want to put those back in because they grow kind of crazy. So stay tuned. I'll show you guys how it goes. Taken out most of the pluggy grafts that are up here in the frontal row. We're gonna leave the ones that are farther behind because you can't make a lot of incisions here in the hairline. It will scar, so there has to be a spacing between what you can do. Now what this allows me to do is kind of start with a more blank canvas just in that frontal hairline and reconstruct that with one hair grafts that are much finer, and that will hide the rest of the pluggier looking grafts and overall just make this better. I'll also break up that straightness of the hairline that she had and make it more uneven and zigzag, and that also will make this look a lot more natural. So next step is going to be creating all the incisions to be able to put the grafts into. guys, so what I've done now is I've created all the recipient site incisions. This is kind of a technique that I've figured out over the years. I do a special pattern around the bigger grafts to try to mask them, and then on top of that, we've punched out some of these other grafts that are in the hairline, and we've repurposed those, and we're gonna reuse those. And some of these we're not gonna place. We've zigzagged the hairline and broken it up, made it more uneven, so that's gonna look a lot more natural. I've also turned these sides. There was a very straight line, and what I've done is I've essentially curved it a little bit to try to make it a little bit more natural looking. So next step is going to be placing the grafts into all these incisions, and we'll show you guys how that goes. Hey guys, we're done with our case today. It was probably about 7 hours long, and we fixed her hairline really nice. I'm really excited to see how her results are going to turn out. We'll show you guys down the road how things look, but we got rid of a lot of that plugginess and fixed it, corrected it, put a lot of one hair grafts in the hairline, and it was a long day, but it's all done and it's going to look great. Thanks for watching, guys.